All right. Dr. Sean Hedmann, welcome to Cannabis Talk with Mike Lawson. Thank you
Thank
for
you.
joining us.
Thank you for the invitation, Ms. Lawson. It's very nice to be able to interact and talk about medical cannabis. Okay.
Absolutely, absolutely. I'm really looking forward to getting your thoughts on some of the new research that has come forth about CBDA and CBGA as it relates to COVID-19.
Right.
I think they
Right.
just published that in the journal back in January. Can you tell us a little bit about your thoughts on that?
It seemed to be quite I don't want to say it came out of the blue, but nevertheless, it seemed to so much information and research had been directed to interfering with the spike protein of the COVID virus. That seems to be the way that the COVID able to infect the cells. And I think just a lot of people are just throwing different things out there. Certainly, the whole world of cannabis and different cannabinoids that are available made that a very, like a good place to start for these researchers.
Right.
And as it turned out, it was just odd that at least when they concentrated on the spike protein, it was the CBDA, the CBGA, and the THCA that seemed to be the one that interfered with the spike protein most effectively. Oddly enough, it seemed like CBD, THC did not have the same efficacy. And the whole thing, if you can certainly have the COVID virus not infect the cells, then you're way ahead of the game. The problems that was pointed out is that these were done to, as they say, test tubes and petri dishes. Uh, the type of concentrations that were used to have this impact was almost about 1,000 times higher than what you could expect to go and see in the circulation from the more routine ingestion of these.
Interesting.
So it seemed like it may not, and I think it's almost like you could not get anywhere near to that concentration to impact on the spike protein from the usual type of ingestion. Certainly not even inhalation. You just could not get anywhere near that. So I guess it was a nice place to start, but exactly how it can translate to clinical benefit was certainly uncertain. Mind you, again, this is CBDA and CBGA compounds that they're now available because we got people that can extract these compounds out of the cannabis plant. But
Right.
as far as being readily available, is another whole thing on its own. But
Absolutely.
but the one thing that did come out is that when they went to go and see if they could find any clinical benefit, there was a study, they've been following a lot of these Epidiolex patients. I mean, this is the new FDA high CBD compound that's being used for epilepsy. And of course, even though it's been released, I'm sure the FDA is making them keep a close eye on things. And it is a higher CBD dosage that you would expect, even most patients with more common medical problems to use. And as it turned out, they're following 1,200 odd patients. And of course, there's match controls. And they did find that to a significant degree, that I think the number I saw was 40 to 50% less, lower amount of these patients taking Epidiolex tested positive for COVID-19 than their controls. Lifestyle, if you have epilepsy, are you less prone to go run around town? A lot of other variables in there, but it was just, if anything, they could tweak this out of an established protocol, and everybody was getting tested left and right. So they just found that it was a lower percentage of people testing positive for COVID. I think that I think they did more investigation. I know they did some studies on mice, and again, that's another thing that doesn't always translate well. They were trying to use CBD Again, and as it does have an anti-inflammatory effect, and they think that a lot of the really bad outcomes that people have with regards to COVID infections is the rather severe inflammatory response that is produced. And what they found that it wasn't so much the anti-inflammatory effect, but that the CBD actually prevented the virus from replicating within the cells.
Right.
And they think, and the whole thought is that they were able to do so by having the cells produce good old-fashioned interferon. So if you take that piece of information that if you can't replicate, you can't really infect things. And if you take the information from the epilepsy study, well, maybe these people had enough CBD that the virus got in there, but couldn't go nowhere. And so they just didn't test positive for it. So it could, of course, a lot of this is somewhat speculative, and the information is, not, it can be very difficult to interpret and put into the context of clinical benefit. But everybody's calling for more research,
Right.
and so given that COVID is not going to go away, we might as well figure out how many different tools we can have in our toolbox and move forward.
Right. And that's an excellent point. Thank you for sharing that. And a quick question. We circle back. You mentioned something very important. That the dosage that the was used in these experiments was much higher than what's available on the retail market, if I understood you correctly, right?
Well, it's by the time you're to ingest 50 odd milligrams of any cannabis distributed in the body and the bloodstream, it goes down into the nanomilliliter concentration, which is again about 1,000 times less than the micromillimeter they were using in the studies.
Got it. And so, do you think, from your experience with working with patients and understanding milligrams and different dosages when it comes to the flower or edibles or so on and so forth, do you think that it's realistic that uh, whether big pharma or your local growers and manufacturers and cultivators will be able to put a retail product on the market that can deliver the dose necessary to be effective when it comes to COVID?
Okay, first of all, it's CBD. So, and given the hemp industry, what it is, CBD is becoming much readily available for, all sorts of different edible products, not so much inhalation products, but definitely, edible products. And one of the downsides of inhalation is that you really only get a relatively small percentage of the available cannabinoids get into the bloodstream. So at least in theory, you have a higher chance of
Absolutely.
getting better circulating levels with an oral or preparation. Um, Sometimes, again, when we're starting to get into these higher doses, again, even Epidiolex is a extremely high dose. It could, it's theoretical that they could reach a high enough dosing, but I do fear that the cost may be prohibitive, that none of this is being covered by, medical insurance. And, you know, um, if there was overwhelming evidence that that could work, people would, lay out the money and get it. But I don't know. I don't know. Again, we're taking shots in the dark and
Right.
just what happens. So
We need more data.
we need more data.
We
Yes.
need more data. That's the consensus in the science and cannabis community worldwide, really. I want to also circle back because some of our listeners may not be familiar with cannabinoids in terms of the acid compound,
Yeah.
and not.
Oh, yes,
Yeah. So
yes.
can you kind of explain that?
The acid compounds are actually what exists in the plant before you heat it. I was told the number is 240 degrees Fahrenheit,
Right.
above that, and decarboxylate off the acid group. And then you get the more, the more familiar cannabinoids. So one of the ways that a lot of patients do is take their plant, and they don't process it or heat it. They take it and make tea, or they take it and juice it. And so the plant, all the all the cannabinoids in the plant are coming out as the acid form. So they're getting the THCA, they're getting the CBDA, the CBGA. And it's only been recently that they've been able to, again, science being what they're able to isolate, concentrate, and then, give patients, pure THCA, pure CBDA, and sort of report how they feel.
Right.
So it turns out that the CBDA does have a more anti-inflammatory effect than the other cannabinoids. And I had a patient the other day. When I was telling him about using this in tea, he says, "Well, I've been doing that for years. I've just been juicing it, or putting juice, mixing it with orange juice." And I'm like, okay. And I circled back to ask him about his arthritis that was giving him trouble in his hands. He said, "It's working really good." I was like,
Mm,
okay, well, there you go.
interesting. Interesting.
So, yeah, and so so there is medicinal benefits for the acid compounds. The one thing about THCA is that it does not have any psychoactive effects.
Right.
So that
Right.
can be a good thing to start your day.
Right.
But if you're trying to use it for something related to more like PSD,
Right. Post-traumatic
PTSD,
stress.
post-traumatic PTSD, part of the benefits of the cannabis is to allow your brain to disengage from the world and sort of reset itself. You don't kind of get that effect from THCA. So it is
Right.
truly for mostly pain benefit and anti-nausea effects that you can use the THCA.
Absolutely. One thing I forgot to mention that we were both on a webinar with Dr. Sulak from
Yeah.
healer.com.
Mhm.
Shout out to
Yeah.
Dr. Sulak. It was just an excellent webinar. And he mentioned something that I missed in the study, that the scientists actually did not do a deep dive on THC because of its Schedule One status, and it would be too expensive, too time consuming. And so I found that to be very interesting, in that we don't have much data on this period, but particularly in regards to this study, we don't have the data on THC. So who's to know, how effective or ineffective it would be, you
Right.
know.
And the Schedule One status has certainly stymied a lot of medical research. Medical cannabis research is booming in Israel.
Right.
That's where a lot of our information comes from. But
Absolutely.
yeah, we're kind of way behind the curve when compared to other countries.
Oh, we're way behind.
Mm.
We figure out how to tax it, but we can't figure out how to research it. So hopefully
There you go.
we'll
Yeah.
work on that in 2022. I don't want to keep you for too much longer. Before we wrap up, I want to talk real briefly about what are your thoughts on the most effective ways to use cannabis, right? What's the most effective way to deliver THC or whatever particular cannabinoid you're trying to use? Um, is it inhalation? Is it ingestibles? Is it tinctures? Is it nanotechnology? Is it topicals? Can you speak to that?
You, oh my gosh, I ask people pretty religiously, well, how are you using it? And I have the entire spectrum of things that I hear from it, because people have figured out what works and what doesn't work for them. The two things I can say generally is that if you need quick relief, if
Mhm.
you've got an anxiety attack coming on, if you feel a migraine coming on, and you really need to have something up and running quickly, an inhalation form seems to be the way to go, be it a vapor pen, be it a joint, be it a tabletop vaporizer.
Mm.
Those are what you really need to get in and get working, and try and, if you will, control the symptoms as quickly as you can.
Right.
That being outside of that, all the edible forms tend to have a much longer duration of circulation and hence effect.
Right.
So that where I mentioned when people tell me, I'm having to use my vapor pen every 2 hours, I switch. Say, well, have you been using any in edibles? And then we go back to things, and they at least a percent of them want to be at least to reintroduce, edibles. Maybe they didn't have a good effect, maybe for various reasons. But, the duration of effect is very important to sort of, you don't take a regular medicine every 2 hours. They certainly do have more longer acting you can take once or twice a day and get good
Right.
benefit. And
Right.
so that's why I try to have some patients, if they haven't been doing it, to at least certainly try and again, between tinctures and the tinctures with nanotechnology. And yes, there is actually evidence that what sounds to be nouveau gruvo, there actually is evidence that it does have better bioavailability, that it gets more easily absorbed. Some people use the nanotechnology in the oral mucosal absorption to get it into the system quickly. And be it just people like their gummies have become a pretty established way that people get, precise amounts of combinations of CBD,
Right.
THC, even so they can pretty much find a percentage, 1-to-1, 2-to-1 combination that works for them and stick with it. And once they know what works, and it's good. But again, all ingestible forms tend to last longer. So that's always seems to be my preference, if I had to, all things being considered.
Got it. So when you want a longer duration, we want to go with an ingestible.
Yeah,
But
yeah,
when we want uh quick effects, we want to go with an inhalation.
that would be correct. Yeah.
Absolutely. And can we circle back too for some of the listeners who might not know what bioavailability is?
Oh, yeah. I'm sorry, we slip into medical leaves way too easily sometimes.
Oh no,
It's
but the people need to be educated. They need to know this.
oh,
So
it,
this is great.
it's the ability of any thing that you inhale, ingest, to be able to get into the body, into the circulation, and have a projected or expected effect. Um, if again, surprisingly enough, the actual amount of bioavailability you get from inhaled products is relatively low of the percentage that's actually in the product you're inhaling. Ingestible forms, how much gets absorbed through the stomach, how much gets metabolized by the liver before it gets into the circulation. All those are variables that are very individual. But
Right.
when it comes down to if we really need to try to get as much of the cannabinoid into the circulation, you try to improve the bioavailability. You try to get it so that it can get absorbed, get into the circulation, and have the effect.
Got it.
And for each individual, it's very, very variable. People will seemingly, use a 25 milligram gummy, get a great effect. Other people takes 100.
Right.
So, so
Absolutely. Absolutely. One more question before we wrap up. So, for the past 2 years, there's been this urban legend that, uh, cannabis, uh, if it doesn't, some people go so far as to say it protects you from COVID. Some people say it eases your symptoms. Um, we have the study with CBDA and CBGA, which prevents replication, but we know, like you said, that's at very high doses.
yeah,
Um, and no tests on no human tests yet. So the data is not in. However, also in the webinar that we were on about 2 weeks ago, and I've had this experience in the community as well. Many medical cannabis doctors are having this subjective um, observation that many of their patients are faring better with COVID symptoms
yeah,
through their use of cannabis. And like you said, people are using cannabis in a number of different ways, all at the same time. But it was very interesting to be on that webinar with hundreds of people, many of whom are doctors, And it seems to be this consensus, not only in the United States, but all over the world, that
Yep.
there seems to be some kind of entourage effect with these cannabinoids, right?
Oh, yeah.
And that this paradigm shift towards the whole plant, and that we're isolating these cannabinoids, using CBD for inflammation and using, CBG for this and CBN for that, and so on and so forth. But as we always discuss, the data is not there, but subjectively we are seeing that all these cannabinoids are working in concert together in some kind of form or fashion. So can you just speak to, has that been your experience? Have you heard other doctors
I,
express
I,
that, or
I've heard it be expressed beyond this other seminar, and you're right. The people who seem to be surrounded by people getting tested positive for COVID, and they seem to be, clear. It's very, very compelling, very suggestive, and again, given the many different ways that we know that the cannabinoids interact with the endocannabinoid system, it's any best guess. Is it an anti-inflammatory effect? Is it the fact that it really prevents the COVID virus gets in, can't replicate? It's people may be getting milder forms of illness because there's, their body, the cannabinoids have activated their immunologic system to the point that it's fighting back the virus more effectively than non-cannabis users. So it's there. I mean, the whole basis of trying to go and do research is getting subjective anecdotal information and saying, well, how does this work, and why do so many people seem to have that, and can we test that? Again, the Epidiolex study was one thing they were able to say, that yes, these people were doing better taking high dose CBD versus their controls. So, uh, and again, even if you do the study, are you going to be able to find out the mechanism? May not. So it's just so many multifactorial that can multi areas that the cannabis can help with the body's day-to-day function, that, if it works, it works. And how? We still not quite sure.
we
We
don't
may
know?
never really know.
Right. But the good news is it works. Right. And
Yep.
so thank you so much. I think, maybe for our next segment, we can really take a deep dive on the endocannabinoid system, right? Because
Yes.
I
Yeah.
feel like so many listeners, far and wide, educated, professional, regular civilians, are unaware of what the endocannabinoid system is, what its function is,
Right.
and how the cannabis plant interacts with it. And so maybe we could take a deep dive on that
Yeah.
next time. But thank you so much for your time, Dr. Hedman. Is there anything else you want to share before we close out?
No, no. Keep me on the line. I could just keep going for another couple of hours.
Man, listen, I could, if I had all the time, I would use all the time. But thank you so much for joining us, and
Well,
we're gonna make sure we get that endocannabinoid system episode in ASAP.
okay. Quite good.
All right,
Okay.
thank
Have
thank
a
you,
good
doctor. Talk to you soon.
talk to you soon, then. Okay. Bye bye now.